Okay, thank you for joining May 26 office hours. I'm Stefan Bishop, the Service Insights Manager here at the Food Bank of the Southern Tier, and I'm covering for Lindsay Allen, who is enjoying a nice time camping. And we're here, we're talking about HIPNAP updates right now. The emergency pooled grant is now at zero. An advanced grant has kicked in that is available through the end of June, currently at 37,000. So we're asking agencies just to double check their orders to ensure they don't owe a balance and just check your grant situation since it is different for each pantry. The next installment for HIPNAP starts July 1. So if there aren't any questions about that, I can go to the next slide, or if there are any other questions, Mary or Calvin, that you came on to ask. I just had two other updates. One was from Kathleen Passetti, who is starting training on a new system to collect data on pounds for the retail recovery program. Up until now, you would be reporting this using PWW, the same site that either you submit stats or you place an order. But now there's a new system. Kathleen is onboarding sites to she has a number of demos that she's scheduled a number of office hours as well. So there's plenty of chances to learn more. She just wanted me to share this with you guys if you needed to put those on your calendar. And of course, her contact information is here as well, phone number, email. So I don't know if there are any questions about that. I'm not an expert on Meal Connect. I've heard it's pretty straightforward and very user-friendly. At least that's what people say in comparison to SimSy, which is a little bit more complicated. Um, so just wanted to share that.
I have
And
been using it up
yeah.
in Livingston County for a few years, so I've
Oh,
been
nice.
working with Kathy and can be a support as well.
Oh, awesome. And how has the
Mhm.
experience been with you?
It's very easy. We
Okay,
enjoy it. It's quick and easy and not a problem, and the reporting is great. So,
awesome.
mhm.
Cool. And then since I am the Service Insights Manager, I did have some things to share. Nobody showed up to my office hours last week. Um, so just taking this opportunity, we did put a lot of this information in the newsletter. So if you read the newsletter, you should be aware of this already. But we are now collecting stats for all food assistance services, not only the 3-day package. So some programs maybe only offer the 3-day package once a month, but on a daily basis, you can come in and get bread and produce. Um, so we're going to do two reports. We do our internal reporting, we do our TFAP reporting, and we do our HIPNAP reporting. It was for HIPNAP that they require you to offer a 3-day package in order for those stats to count for HIPNAP purposes. But outside of HIPNAP, we're going to begin collecting this information just for our internal purposes and the TFAP as well. They want to know everybody who's getting food at any point in time, regardless if it's a 3-day package. But we are only doing this for sites that are active on SimSy. So this is sort of an incentive. If you want those stats to kind of show in your reports and our reports, obviously outside of HIPNAP, we will begin doing that. So there's a handful of agencies that we've started doing that already. Um, Another kind of pain point for everyone, you may have noticed that there have been data syncing issues. The reports normally are supposed to refresh at midnight every night, and for whatever reason, it's been taking 2 to 3 days to actually sync up properly. So just wanted to let people know that we are aware of that issue, and if you're seeing that issue, Feeding America is working on it. Um, and then a new update, you'll see this in the June newsletter. Feeding America recently changed the dietary factors question. Not every program uses this question, but this was the question that kind of asked, are you gluten-free? Do you have any allergies? And things like that. And they just reworded it a little bit so that it no longer includes any information about a health condition. And this was so that they could be in compliance with HIPAA, so that a health center could use the system without, you know, worrying that they'd be collecting, you know, medical information. So I think even if you're not using SimSy, the guidance that they provided was actually really helpful just in terms of how you phrase interacting with the people that we serve, always ask about the type of food that a neighbor needs, never the disease or condition behind the need. So there is a resource that Feeding America put out that kind of explains their reasoning and what the changes are, and that will be shared in the newsletter. So if there are any questions about that, I also have access to the PDF too, if people wanted me to share it. But that wraps up the SIMC updates, the HipNap updates that we had. So I don't know if there are any questions from those in the room. Glenda asked about pistachios. They are on the menu.
I
Um,
I I have a question,
Hi,
Stefan.
Mary.
I'm the squeaky wheel when it comes to SimC. I'm
Yeah.
sorry. Is there any info on that whole person of unknown age?
I haven't received an update yet.
Okay.
So what Mary's talking about is right now when she does an essential stats report, there's a certain number of people who are showing up with unknown age. Um, versus when I go and look at all of the data that from the service data, everyone that's been served at her pantry has an age. So I think there's a data syncing issue there, a possible glitch.
Well,
Um,
and not
yeah,
to interrupt you, one
yeah.
thing I've noticed is so when I was at least more recently when I was doing Stewart Park, our special, right?
Mhm.
Um, I did notice that I forgot whenever I was inputting the new data, I forgot to put someone's date of birth in. And then when I updated the record, as I was pushing them through, right, because they showed
Mhm.
up to get the food, um, I noticed that they weren't, that was the person. Originally, it was just one person of unknown age in that group. And then it became more than that. Then now there's two, which isn't a huge deal. It's just when we have lots of people with unknown age, I've seen them when I go back into the records. I will see that everybody has a date of birth,
Mhm.
but I need that information for my own, so I
Right.
know how much we're serving, and I know you guys keep that, but I need it like kind of sorted down. So I do notice sometimes it's
Yeah.
an issue, and I noticed that with Dayspring, they weren't including it, or you'll put an age in, but you won't put a date of birth, and so it's making it an unknown age, which is very frustrating, especially when there are sometimes when there is date of birth in there for all of them, and then I have to go through and manually like put that, figure that out so that I know for myself for that distribution how many children, adults, and seniors were served. So it's just that's a huge glitch on my side of things, just like I know you've experienced some glitches, but
Yeah.
that's some huge glitch because that's just creating more work for us on our
Sure.
end.
And
So
whenever we see a number of people who are of unknown age, it's normally a pretty negligible amount, at least when you look across the entire network. And so when we see, our entire totals for the month, it's less than 3% are of unknown age. And so we'll just assume they're adults, and that's how we'll report them to HipNap. We add the
right,
unknown ages to
right,
the adult category. So just letting you know how we handle that when it's unknown. We
right,
also understand
and
there are instances where a person does not feel like they can answer that question, right? They don't feel comfortable sharing that information. So we understand in some cases we might not ever get that information. Um,
okay. But what I mean, and that's the way it is for the one for Stewart Park. But then
yeah,
for one of the other ones we did, like Stewart Park, it was like two of unknown age, which I was like, okay, that's not bad. And I do exactly what you said. I just put them
yeah,
in as adults. But when you have like there was another one, I think it was Family Service Society. It was 70% of them or 60% of them had unknown age, which was like that's ridiculous. And
yeah,
and the issue, Stefan, that I had is they all had date of birth. So like
yeah.
on
So
your
I
end,
think
you're
that's a
seeing
glitch
that.
because yeah,
Yeah.
I looked at your data this morning and it looked like there were for the month so far 41 with unknown age. That's pretty high, I think.
Right.
Um,
So
but
that's
Feeding
frustrating. But
America is Um, they'd like to take their time getting back to me, but I will let you know as soon as I get an update if there are any
Okay,
changes.
sorry.
There are, and we have monthly calls with them. There are like two or three that I'm on, so I can raise the issue vocally as well, not just, using the little bug form that we use. But I'll just make sure people are aware that that's happening. Um,
Okay, I appreciate it.
yeah.
Thank you.
Yeah.
I have a question that I came across huge into data. So the service trends report, even though
Mhm.
you put in the filters, it doesn't do it by the filters. So I can like filter for the year, but when you look at the graphs, it's like May 25 to May 26, even though I put in January 1st, 2025 to December 31st. So
Yes.
the reporting isn't always
It is confusing because the dashboards are set up to show a certain thing, and then the filter will be like, will just reduce the data that shows up on the
okay.
dashboard,
Because yeah,
if
because
that
I'll
makes sense.
I'll
Yeah,
put in the filters, but then the graphs it's showing it's not
right.
showing
The
what I'm
graph doesn't
asking for too.
change. Right. Yeah.
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 So it's really hard to like pull numbers for reporting and things like that when I don't know. It's just you
Yeah.
don't know what. So the one I'm looking at, like households by day of the week, is it going by like that first graph that is May 2025 to May 2026, or is it going by my filters? So
It is going by your filter.
okay.
Um, One way to kind of like check that is like, um,
Can I
you
share
can
my
toggle
screen?
between the daily and weekly.
Mm-hmm.
And if you go by weekly, but
Mm-hmm.
maybe, the first was in the middle of a week,
Mm-hmm.
you'll notice a difference
Mm-hmm.
between the data that shows up from week to week, depending on the filter.
Mm-hmm.
So it is updating based on the filter.
Okay.
It's just the graphs themselves don't really change.
Mm-hmm.
Um,
Okay.
yeah. Any other questions for me, for Matt? HipNap, TFAP, SimSy, Meal Connect? Doo, doo.
Hey,
Okay.
I have
Went
a
good today.
last
Oh, of
question
course.
real
All right.
quick.
Yeah, go for
Sorry.
it, Mary.
So tilapia or pollock, has it come in and I am not seeing it anywhere? Or I'm too slow in general, like on the menu. Did anyone see tilapia
Matt
or
was looking
pollock
at the
recently?
inventory. You're muted, Matt.
Sorry about that. Thanks, Stefan. Yeah, I can take a look. Tilapia, and we're looking at, looks like tilapia is on the menu. Let's see.
Oh, Sally, it's saying you were requesting to share. Did you have something to share?
No, I was just going to share the screen to show you what I was talking
Oh,
about,
okay.
but we're good. We talked through it.
Mhm.
Okay. Sorry, I didn't see that request sooner.
That's okay.
I am seeing for the tilapia that was last shipped on May 11th. So that seems odd to me. So it may not be showing up in the system.
Okay, because I
And
don't recall it being
yeah,
offered for the last couple weeks. So,
yeah.
and we're
Same thing
like
with,
completely out. I always try to have like a fish option that doesn't have anything on it, for people that are gluten free or whatever. Um,
sure. Yeah. So I'd say your best bet, Mary, without looking at the actual menu itself, is tuna at this point.
right, right. Okay. All right. I appreciate it.
You're
Thanks.
welcome.
Okay, well, Matt, do you stay on for the full hour in case anybody hops on? I'm willing to give everybody back their time if you guys need to hop off. Maybe I'll just stick around in case somebody hops on. Um,
I don't know for certain, Stefan,
okay.
what our procedure is. Let me message Amanda.
I might,
I
I
I
might,
will say I was on one like the Monday one,
uh-huh.
and there wasn't a lot of like to discuss and stuff like that. So they did end early.
They
I
just
mean,
Okay.
ended early.
yeah.
Okay. I
Mhm.
know when I do mine, I just stay for the time being in case somebody hops on.
Yeah, but
It's
you,
happened before. People will be half an hour late to some things.
oh, yeah, I guess. But yeah,
So
no,
maybe I'll
we,
just stay on till noon, um, maybe five after. Um,
okay, I might head off then.
yeah,
Take care,
otherwise,
Stefan.
willing to let you guys go. Enjoy the rest of your days. Good to see you.
Hey, Matt, is he still
Yeah.
there?
Yes,
Hey,
Mary.
I got the email from Eliza about, I've just been busy here kind of figuring out nothing personal, Simsy, and finding people and so forth. So, I will, she wanted a screenshot of what happened. I just haven't, the waiting room hasn't been open for me to be able to go up there and do a screenshot of that QR code.
Oh, okay.
Okay. So just so that I can show her what I'm getting. And who knows, maybe it's fixed and it's going to prove me a liar or something. So,
Mary, is this referring to the Snap banner?
yes,
Okay. So I did respond to you, and
you
yes,
did. You
yes,
did,
we
but she
we mhm.
she just sent me an email though, what I'm saying, asking
Eli-
for, yeah, Eliza did. I think it was Eliza who did. Let me
Eliza's
look
with
it up.
just say yes. I'm not
Yeah,
sure why she
yeah.
would be
She said I
messaging.
wanted to double check in on your concerns regarding the QR resource sheet. Can you send
Oh,
me
okay.
a screenshot of where it takes you, please?
Gotcha.
It's leading me to, and I clicked on her link,
Hmm.
and it's not what I saw
Okay.
when we did it, and the young man did it that was here.
Okay. Okay.
So I'm gonna do that. So I will just. It's just been busy this morning.
No worries. Thank you. Now I got
All
you.
right, all right. Take care. Bye, everyone.
Bye.
Bye, Glenda. Bye,
I gotta
Mary.
sign off.
Bye, Sally. All
Well,
right.
we'll stay on till 12. There we go.
Okay.
Well done.
Thanks.
Yeah, so for the questions related to food, sometimes it's helpful to go into Primarius P2. You can see I did email Glenda information on the grant,
Okay. Thanks, Matt.
so she has all that.
Yeah, that's one thing I don't have a lot of experience with is the inventory side of stuff.
Yes,
Yeah.
just like with SimC, I think you'd be able to navigate P2 pretty well. You've done it to a certain degree, right? When you were in the PPC land.
Yeah, but even then it was like I would just ask somebody else what the answer
Oh,
to the
okay.
question
Okay.
was.
Gotcha.
Yeah. Like I would
Gotcha.
look up people's orders and
Hmm.
check on their
hmm
grants to
hmm
see like how much they had. Like I would check balances and things like
Yeah.
that.
Yeah.
And I would check the TFAP list when it came to like, is it on the menu and do we have it in stock? I never really went that far with it. So,
Okay.
but yeah, I should do some poking around to see. I'm sure it's not hard to find.
I get nosy and I like to check on things, and I'd like a detective work scenario, so
Mm.
I fall into those things pretty easily.
Well, thanks for your help today.
All right, you're welcome. Thank you for
I
leading
wonder,
it.
maybe we can edit out that last 2 minutes of just us talking before we send out the recording.
All right, yeah,
Um,
absolutely doable.
but otherwise, I'm gonna go ahead and end the meeting.
All right, thanks,
All
Stefan.
right. See
Bye.
ya.